Abdominoplasty is a very commonly requested operation. Very often ladies who have reached time in their life after they've completed having their family, sometimes they'll have associated cesarean scars having had babies in the past, and as a consequence of all of those kind of changes to their body, they either have stretch marks in the lower tummy or a bit of excess skin and sometimes excess fat. If it's purely just some excess fat and good quality skin, patients can do well with liposuction. But for some patients that's not possible, and you actually have to physically remove the skin in the lower tummy, and that's usually from the area below the belly button. Some patients don't require complete removal of all of that skin, and they just need removal of a small amount of that skin, and we tend to call that a mini abdominoplasty. But essentially the scars tend to be the same. They tend to be fairly longish scars. We tend to put them in a position that the patient is comfortable with. So I do tend to discuss with patients a lot preoperatively where they want the scar placed. We talk a lot about as well and make sure that the patients don't have any bulges in their tummy and don't have any hernias. And if they do have a little bit of a bulge, particularly where the muscles in the center of the tummy are a little bit weak, I'll discuss with the patient about the opportunity of dealing with that at the time of the abdominoplasty, and that means tightening the muscles inside to try and flatten the tummy a little more. Doing liposuction at the time of abdominoplasty, I will do that particularly around the back area, because what's not unusual is when you close the tummy at the time of the abdominoplasty is that the kind of fat area in the flanks tends to get pushed out a little bit, and patients don't like that afterwards if it's not dealt with at the time, and it's quite safe to deal with that at the same time that you do the abdominoplasty. What can be a little bit risky is doing liposuction to the skin of the tummy above the belly button at the time of abdominoplasty, because that skin is going to have to be pulled all the way down to the scar in the lower tummy to close the tummy. And to be able to do that, you've got to undermine the skin and lift that skin off the tummy wall, and in doing that you interrupt the blood supply. So there is a risk in doing liposuction in that area at the same time of causing further disruption to the blood supply, and in doing so it may cause wound healing problems. So I'm a little reluctant to do that, and I tend to reserve that as a secondary procedure if it is required. Preparation for surgery is like pretty much any operation, and again I would see the patients twice before surgery, and I would go through the operation, the recovery and the risks in considerable detail with the patients. They do have drains after surgery, usually come out the next day, and patients will go home usually the day after surgery. Some patients need an extra day. Some patients it takes a little more out of them. I tend to put my patients in a garment afterwards. I know not all surgeons do that, but I do think it helps to get the skin to stick down and to reduce the risk of fluid collecting under the skin, which is called seroma fluid, and I would prefer that that wasn't there. It can be drained afterwards, but it can be a nuisance for some patients. I think it does help to improve the result a little, but I don't insist that patients have to wear their garment, but I think it does help a little bit. So we usually get the patients measured up before surgery for their garment, and then they wear that for about 6 weeks after surgery. The risks with abdominoplasty, again, fall into kind of two categories, which are general surgical risks that we see really with any operation, and very specific risks associated with abdominoplasty. What patients need to be really aware of is that a long visible scar in the lower abdomen and a scar around their belly button. And again, most patients with scars will usually settle very well over a period of about a year to 18 months, but some patients do form very thick, red, angry, lumpy, itchy scars. And this is called an abnormal scar or a hypertrophic scar, It can be managed with steroid injections and scar tape and so on. We need to make sure that patients are aware of this, because it's probably in some way related to tension in the closure. So if you've got a lot of tension on your closure, it seems that we tend to see a bit more hypertrophic scarring in these patients. So we need to discuss that, and patients need to be aware of that. Seroma formation, as such, is not a complication. It's really a nuisance, and we like to try and reduce that as much as possible, and there are things that we can do to reduce that. Meticulous surgical technique is helpful. Using drains can help. Garments help a little bit. Reducing activity immediately after surgery, and patients not trying to do too much too quickly seems to help as well. So, but even then, some patients will get seromas, and we've got to drain them in the clinic. Now, fortunately, it's not an uncomfortable procedure to do, because the skin on the tummy is numb afterwards and is for quite a long time. So sticking a needle in and removing some fluid is usually not a particularly traumatic thing to do for a patient. There are risks like wound healing problems, higher risk if you do liposuction to the upper abdominal skin at the same time, so I tend not to do that. There are risks with small bits of skin dying in the lower part of the tummy, and again, that's very unusual. It comes down to patient selection, operating on patients who are fit and healthy, not overweight, and who don't smoke. I will not do this operation on a patient who smokes. There is a risk of leg clots, and obviously those it is very important that we take measures to make sure that risk is reduced as much as possible. I personally have not had the experience of a patient developing a leg clot as a result of this operation, but it is well reported, and it is very important that patients understand that we need to take measures to reduce that risk as much as possible, because they are potentially life-threatening, and that's a very important issue for patients. And other than that, we do discuss scars around the belly button. We do discuss the position of the belly button, and there is a very small risk of the belly button being slightly out of position. So it's very important to point out to the patient preoperatively exactly where their belly button is in relation to their midline before the operation, because not everybody's belly button is exactly in the midline. So, so long as patients are aware of that, then before surgery, then they will accept the position after surgery. We try to put it back in the same position, essentially. It's very, very rare to see the belly button not surviving as a consequence of this operation. That's a very unusual problem. Numbness is something to expect. The skin of the lower tummy is numb. It does get better over time, but patients need to be a little careful about not injuring their tummy. For instance, doing the ironing and leaning up against a hot iron and burning the skin of the lower tummy. And I have seen that because the patient couldn't feel it. So as a consequence, we have to explain that to patients, that they are aware that things like that are just to be a little careful until feeling comes back in the tummy, and that takes a bit of time. So, but generally speaking, most patients will go through this surgery very comfortably and very quickly, quick recovery without any major problems. Again, providing that patient selection is very strict.